Hi, my name is Lori Feldman. I'm a social worker with the Center for Memory Health at Hebrew Senior Life. Welcome to today's presentation. I'm going to share my screen so you can follow along. Today we're going to be talking about understanding and managing cognitive change in older adults, when to be concerned, what to expect, and where to turn. We'll be talking first about cognitive impairment definitions, and then the difference between normal aging and cognition, and when it's time for a diagnosis of dementia. We'll talk about treatment, research, and resources, and then as part of our discussion, we'll introduce you to our team here at the Center for Memory Health. It's important to understand basic terms and definitions. What is normal in our cognitive change as we age? Cognitive change as a normal process of aging has been well documented in the scientific literature. Here are some examples of normal aging and cognitive decline. Forgetting names or appointments, but remembering them later. Losing things, but finding them by being able to retrace your steps. Forgetting parts of an experience, but remembering that you did have that experience, maybe not all the details. And changes in vision can be an indication of some normal aging and cognitive decline. Mild cognitive impairment, also known as MCI, is the stage between expected cognitive decline of normal aging and the more serious decline of dementia. Changes in thinking abilities are noticeable to the person affected or to family members, but they minimally impact daily living. So some of these symptoms include forgetting events more often, such as important appointments or social engagements, losing your train of thought or the thread of conversations, books, or movies, feeling increasingly overwhelmed by making decisions, planning steps to accomplish a task, or understanding instructions, starting to have trouble finding your way around familiar environments, and becoming more impulsive or showing increasingly poor judgment. What is dementia? Dementia is not a single disease, but rather a term that covers a wide range of medical conditions, which includes Alzheimer's disease. Some of the most common types of dementia include Alzheimer's disease, vascular dementia, dementia with Lewy bodies, frontotemporal lobar degeneration, Pick's disease, and Parkinson's disease. There are 10 early signs to look for when wondering if you do have dementia or signs of cognitive decline. Some of these include memory loss that disrupts your daily life. So not just forgetting something and remembering it later, which usually winds up being okay, but something that actually means there are consequences to forgetting certain things. Challenges in planning or solving problems. Difficulty completing familiar tasks. So this could look like making coffee in the morning and having trouble remembering the sequence of events to make that coffee. Confusion with time or place. And this could look like a person who doesn't remember that they saw you yesterday and thought it was much longer ago, or not recognizing familiar surroundings. Trouble understanding visual images and spatial relationships. An example of this could be looking at a dark rug on the floor and thinking that it's actually a hole in the floor, so they walk around the rug. New problems with words in speaking or writing. So this could look like a person speaking or expressing themselves with more difficulty because they can't come up with the word that they would normally have no problem thinking of. Misplacing things and losing the ability to retrace your steps. A decrease in judgment or having poor judgment. And in this case, that could look like um, someone taking a risk in terms of crossing the street without looking, or leaving the house wearing improper clothing if it's a cold day, not dressing up warm enough, and not having the awareness to dress more appropriately. And this comes down to a risk for safety. Someone may withdraw from work or social activities. And one reason for this is that they may have some trouble with some of the earlier signs that I just went over. They might have trouble following a conversation, confusion with understanding the topic or what's going on, trouble concentrating. And so if someone has trouble following a conversation, they may actually withdraw so they don't put themselves in that uncomfortable situation. And changes in mood or personality can also come up when someone is displaying some early signs of dementia. Remember that having a diagnosis of dementia means that there are changes going on inside the brain that naturally affect how the body and mind function. And these could include changes in our coordination, how we see things, like I talked about the rug, the dark rug that may look like a hole in the floor. And it also can affect our mood and personality. And the person who is experiencing these symptoms doesn't want to, and they would like to function the way they used to, but they don't have control over it because these are changes happening in their brain, and it's something that they're not able to change on their own. Now, there are treatable conditions that can cause dementia-like symptoms. And this is important because whenever you notice a change in how you feel physically or emotionally or cognitively, it's important to be in touch with your doctor so that they can rule out any treatable causes and get to the bottom of what's going on. A urinary tract infection or a UTI can cause dementia-like symptoms. Depression, thyroid conditions, delirium, medication side effects, infections, and vitamin deficiencies. So again, please see your doctor if you notice any of these changes so that they can see if there's something treatable and that these symptoms could possibly be just short term. I'm concerned. Now what? If you or someone you care about is beginning to experience symptoms of memory loss or possible signs of dementia, you likely have many questions. And like I mentioned, it is important to speak to your primary care physician or a clinician that you trust to talk about these symptoms so that if there is a way of supporting and addressing them, then you get that help as soon as possible. How is dementia diagnosed? So this is something to keep in mind to expect for an appointment where you come in expressing cognitive concerns. To diagnose dementia, a clinician providing the evaluation must recognize the pattern of the loss of skills and function and determine what a person is still able to do. More recently, biomarkers have become available to make a more accurate diagnosis of Alzheimer's disease. So part of this diagnosis may include getting a medical history and family history, performing a memory assessment to see where you might be having problems and what you're actually able to do well, performing some labs, seeing if there are any vitamin deficiencies or any other kinds of deficiencies that could be addressed, performing a lumbar puncture to get a more accurate diagnosis, and also getting some imaging done, such as an MRI, to see if there are visual changes in the brain that could indicate a particular diagnosis. What happens after the diagnosis? Getting a diagnosis is important, but it's certainly not everything. You want to know how you can live with this diagnosis the best that you can. A multidisciplinary team can help you support your journey. A neurologist can provide periodic follow-ups to monitor changes in cognition. These follow-ups might include cognitive assessments along the way to see if there are changes happening, and if so, where they're happening, so that the neurologist can help figure out how to support you in these changes and how they affect your functioning. A geriatric nurse practitioner can develop a care plan to help the person living with dementia live their best life. They can make recommendations for home safety. They can help with medication management, possible referral to occupational therapy. Occupational therapy is very helpful when figuring out home safety as well as day-to-day functioning in your home to the best of your ability. And the nurse practitioner can also help with advanced care planning, starting some discussions, if you haven't had them already, about what your goals of care are, as well as getting financial affairs in order when everyone can still make decisions about them. Social worker and or a psychologist can be very helpful in providing support to the caregiver and their family as they manage the diagnosis and the changes occurring with their loved one. Caregiver support and family support have been increasingly recognized as something that is one of the most important things to support when someone has dementia. So we want to make sure that the caregiver and family feel like they have the resources and the support that they need so that they can better care for their loved one as long as possible. A social worker and psychologist can also help the patient understand their diagnosis and what to expect as their condition progresses. And this is particularly helpful when the person living with dementia is at an earlier stage of the illness, so that they can better understand what is happening and they can better ask questions along the way. And it's also important, if they want to, be involved as much as possible in their healthcare and the discussions about it. A resource specialist can be extremely helpful to a family because they can find out what your interests are and find appropriate activities to engage the person living with dementia. Like I mentioned earlier, when a clinician is able to help identify not just the loss of functioning, but the skills and activities that your loved one is still able to do, this is where a resource specialist can come in very handy, so that they can find activities to engage your loved one so they still feel involved, productive, and engaged and connected. They can also assist the caregiver and their family with resources related to the living situation, as well as looking at resources to help with any financial concerns and planning for the future. They can also assist with safety equipment, such as a safe return medical bracelet. One of the symptoms that we reviewed, symptoms of dementia that we reviewed, is loss of judgment. And like I said earlier, it's possible that, if not every time, but it's possible that a person living with dementia may use poor judgment in terms of their personal safety. And this could look like wandering, leaving their home or where they live, and going out in a situation where it's not safe for them to be on their own. And a safe return medical bracelet, for instance, is an excellent resource to acquire so that your loved one can be returned safely as soon as possible if that happens. Where can I go for support? So after you have concerns, You go to a clinician, you have a diagnosis, you learn more about the disease and what to expect. Who's going to help you along the way? How can you manage this disease the best that you can, and who can you count on? The Center for Memory Health at Hebrew Senior Life provides outpatient memory care services in person and virtually for people living with cognitive symptoms or disorders at any stage, and for their families and caregivers. Our team will help you navigate your journey and help you live your best life through behavioral and cognitive neurology, cognitive health and dementia care management, family and caregiver support, and resource guidance. And with all of those helpful supports in mind, I'd like to introduce you to our Center for Memory Health clinical team. We'll start with our behavioral and cognitive neurologist, Dr. Alvaro Pascual Leone, our cognitive health and dementia care manager, nurse practitioner, Ann Carr, and our family and caregiver support and resource guides, Lori Feldman, myself, and Dr. Rachel Falk, our psychologist. And that's not all. We also have our resource specialist, Natalie Lopera, and our administrative assistant, Wendy Schulman. And Wendy is the person, if you call us or email us, is the one you're most likely to talk to first. And she's a wonderful resource if you have questions about where to even begin. We also participate in some ongoing research ventures. Dr. Pascual Leone is a senior scientist in the Hinda and Arthur Marcus Institute for Aging Research at Hebrew Senior Life, and he leads research on dementia. These include clinical trials. He's working on Alzheimer's disease, vascular dementia, and Lewy body dementia, some observational studies with neuroimaging and biomarkers, and also comprehensive care practices, including nutritional research and interventions with people living with cognitive symptoms, as well as family members and caregivers. If you'd like some additional resources, these might be helpful. The Massachusetts Executive Office of Elder Affairs is a great resource for information around the entire state of Massachusetts. Your local Council on Aging is also an excellent resource, and they're often affiliated with senior centers. Your local Aging Services Access Point can be something that would be an excellent resource if you're looking for an agency to help coordinate care. So they can help coordinate in-home care, like a home health agency, as well as some other advice and support. And there's also the Association of Life Care Professionals, which is made up of geriatric care managers. That's usually private pay, and they can, a geriatric care manager can be your personal assistant in a way that helps you navigate medical appointments, paperwork, transportation, basically whatever you or your loved one might need. That's our presentation for today. I want to thank you for tuning in. I hope this has been helpful, and please feel free to follow up with us anytime. Thank you so much.